and welcome to the second module in the Community Empowerment chapter of the MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men, and HIV. In this second module, titled Power and Health, we take a detailed look at the strong connection between power and health, as well as the social contexts that support health and well-being in communities of gay, bisexual and other men who have sex with men. After completing this module, you should have an understanding of 1. The connection between power and health outcomes. 2. 3 dimensions of power that promote health and well-being. 3. The key qualities of social situations that promote power dynamics supportive of health and well-being in MSM communities. And 4. The potential for community empowerment to positively impact community health. With these goals in mind, let's begin. In the last module, we looked at the general definition of community empowerment and its importance to effective HIV and STI programming among men who have sex with men. In order to understand community empowerment within the framework of program design, we must step back and look in detail at power and the kinds of social contexts in which power is exercised. There are many different kinds of power, and power relations between people are always linked to how societies are structured and how they allocate resources. Social, political, economic and cultural phenomena determine who has what kind of power and how much of it they have. And power dynamics are a significant contributor to the health scenarios in which communities find themselves. More power means more health, and the reverse is true. The less power a community has, the more prone they are to poorer health outcomes. This is evident in communities of men who have sex with men. Within the largely heteropatriarchal global context in which we live, men who have sex with men categorically have less power and are therefore less able to confront HIV and its spread. It would be naive to think that there is an easy solution to these power dynamics, or that they will change overnight. However, it is possible to run programs that promote environments that can lead to more empowered communities. Let us turn now to the detailed mechanics of power, with an emphasis on the specific kinds of power communities of gay, bisexual and other men who have sex with men need to stay healthy and happy. There are 3 key dimensions of power that promote health and well-being in any community. They are 1. Choice and control, which is the personal dimension of power, both perceived and actual. 2. Community and community integration, which consists of social support, networking, identity formation, learning and adopting important social roles, and enhancing participation in community life. And finally, 3. Access to essential resources, such as work, education, housing, healthcare, nutrition, personal safety, security, and other material and non-material conditions linked to quality of life. The basic mapping of power is the first step in building programs that promote community empowerment. The next step is to look at the specific ways social contexts promote each of these key dimensions of power. These contexts are social policy, governmental and non-governmental organisations, and social support. We will now turn to a detailed overview of each of these social contexts that promote each of the 3 beneficial power dimensions, namely choice and control, community and community integration, and access to essential resources. Choice and control. The first of 3 dimensions of power are promoted by social policies and laws that protect and promote the human rights of men who have sex with men. These lead to reduced prevalence of violence, discrimination, stigma, blackmail, suicide, depression, anxiety, and risk for HIV infection. Governmental organisations and NGOs that provide opportunities for self-development and leadership training. These assist men who have sex with men in developing leadership competencies, strong communication skills, and self-efficacy. And lastly, support for individual expression and personal decisions about same-sex friendships and sexual relationships. This results in men who have sex with men becoming more self-accepting and helps them to retain active roles within their families and social networks. Community and community integration, the second of the three dimensions of power, are promoted by government organisations and NGOs that provide men who have sex with men with a voice and choices. This enhances MSM engagement in social and civic affairs, including national HIV planning processes. Organisations and community-based programmes that provide opportunities for leadership and meaningful participation. These can enable men who have sex with men to influence the organisations and programmes with which they are involved. And lastly, family and friends who are accepting of homosexuality and roles for men who have sex with men. Having these helps to develop and improve supportive relationship structures. Finally, access to essential resources, the third dimension of power, is promoted by social policies and laws that reduce inequality and facilitate access to health services. This results in men who have sex with men with adequate income, steady employment, stable and affordable housing, food, personal safety and security, education and healthcare that includes HIV services. Robust community infrastructure, including civil society groups with strong technical and organisational capacities. This leads to programs and services that are easily available, accessible, acceptable, and tailored to the needs of men who have sex with men. And finally, strong bonds and communication among family members and within social networks. This results in social support from family and friends. Take a moment to check your understanding. True or false? The three dimensions of power that promote health and well-being are choice and control, community integration, and access to resources. True. These three elements form the basis for a community to embody health and well-being. A community empowerment framework for gay, bisexual, and other men who have sex with men consists of the following: connecting and support. Men who have sex with men come together for affirmation, mutual assistance, and support in order to address individual and community needs in a supportive and safe environment. They also strengthen partnerships among other communities and groups of men who have sex with men, government, civil society, and local allies. Respect. Men who have sex with men respect each individual's self-determination and control of his own body. They are meaningfully and respectfully engaged in all aspects of program design, implementation, management, and evaluation, and removing barriers and creating opportunities for their participation and leadership. They are also sex-positive, affirming and non-judgmental of sex, sexuality, and gender expression. Acknowledging and trusting the abilities of men who have sex with men. The strength and abilities of men who have sex with men as individuals and communities are acknowledged and diversity recognised and leveraged. There is trust that men who have sex with men know best how to identify their priorities and the context-appropriate strategies to address those priorities. Mobilising resources. The mobilisation of financial, technical and other resources for organisations and communities of men who have sex with men are promoted and supported. These communities become responsible for determining priorities, activities, staffing, and the nature and context of service provision. Ultimately, community-led organisations become the employers of relevant staff, such as doctors, nurses, social workers, outreach workers, rather than men who have sex with men being solely volunteers, community outreach workers, or employees. Before moving on, please consider the questions presented in this self-check and assess your understanding of the information presented in this module. This brings us to the end of the second module in the Community Empowerment chapter of the MSM Implementation Toolkit. To review, in this module you have developed an understanding of community empowerment and how it can benefit communities of men who have sex with men, as well as the key dimensions of power that promote health and well-being in their communities. As community empowerment is fundamental to the other topics covered in this tool, please keep it in mind as you move through the other modules. In the next module, the third in this chapter, we will explore the characteristic differences between programs implemented for men who have sex with men and programs implemented by men who have sex with men. We will also look at the specific elements that make up community empowerment, as well as concrete steps towards achieving them.